Hello, my name is Michael Kugel, and I'm here tonight to speak to you about an exciting breakthrough in the treatment of depression. The breakthrough comes in the form of a drug called psilocybin, which is known around the world as existing within psilocybin mushrooms, also known as magic mushrooms, which produce profound psychedelic psychological effects. Chemically speaking, psilocybin is a member of the tryptamine family. Tryptamines derive from the essential amino acid tryptophan, and it can be seen here that in only a few steps, enzymes in the body can convert tryptophan into psilocin. Psilocin is the active form of psilocybin, and psilocybin is converted to psilocin in the liver via the action of monoamine oxidase. Psilocin is very similar in terms of its chemical structure to the endogenous neurotransmitter serotonin. Serotonin is also a member of the tryptamine family. It is 5-hydroxytryptamine, or 5-HT, to be precise. What's interesting is that psilocin works in the body by binding to a 5-HT receptor, the 5-HT2A receptor, to be precise. This is a G protein-coupled receptor, and it works by activating secondary cascades of signaling pathways. The two primary signal transduction pathways of the 5-HT2A receptor are the Phospholipase C Pathway and the Phospholipase C Pathway. They both have complementary effects, and I'll go into them now. Phospholipase C induces calcium to be released from intracellular stores through the action of inositol triphosphate. The calcium depolarizes the cell because of its positively charged ions. It also binds to a protein called calmodulin and then blocks the channel through which positively charged potassium ions would normally leave. As a result, the cell is now increased in the concentration of positive calcium and potassium ions and is thus more excitable to action potential propagation. This could be the physiological basis by which people under the influence of psilocybin perceive things that they would not normally perceive. Calcium also has vasoconstrictive effects because calcium is important in the contraction of smooth muscle cells, such as those found in the blood vessels of the brain. The phospholipase A2 pathway also results in vasoconstriction. It releases arachidonic acid, which can then go on to be converted into thromboxanes. Thromboxanes are also potent vasoconstrictors. Of the two pathways, psilocin preferentially activates the phospholipase A2 pathway, but it does activate both pathways, and has a vasoconstrictive effect, which is important in the treatment of depression. It is a symptom of depressed patients that they exhibit higher blood flow to regions of the brain, such as the thalamus, the medial prefrontal cortex, and the posterior cingulate cortex, as compared to healthy controls who are shown in the upper image, as opposed to the lower image. After ingestion of psilocybin, it has been shown that cerebral blood flow to these areas is significantly decreased. In terms of the physiological side effects of psilocybin, they are very benign and few. Heart rate is likely to increase through ingestion of psilocybin for the duration of drug action, which is typically around 6 hours. Psilocybin may also occasion a mild to moderate headache, which does not usually last longer than a day and is dependent in its severity upon the size of the dose. A single dose of psilocybin can produce marked reductions in depression as measured by the Beck Depression Index, and these reductions can last for 6 months or longer according to current studies. In comparison, current medications work in a very different way. They block the degradation of serotonin and thus hyperactivate postsynaptic serotonin receptors. They require daily use. They produce extreme side effects, including increased suicidal thoughts, severe withdrawal symptoms, and toxicity that can result in lethal overdose. Psilocybin has none of these issues, and as a result, is making waves in the media as a potential new treatment for depression. Thanks very much.